Well, hello everybody. It's an absolute privilege to be here today to talk to you about our first Nightingale Challenge Global Solutions Initiative in fantastic partnership with SameYou. We've got a great panel that's going to be talking this through with us over the next hour or so. So my name is Lisa and I'm the programme lead for the Nightingale Challenge. We've got Manashi, who is our young nurse champion for Nursing Now and the Nightingale Challenge and sits on the board. We've got Jenny Clark, who heads up SameYou and is the founder of SameYou, which is a fantastic charity that you'll learn more about throughout the next hour. And then we've got Amelia Clark, the superstar that is not only a huge champion of nursing, I'll let her tell her why, but she's also heavily involved within SameYou. And I won't give away the secrets because Amelia will explain her journey to you. And we've got Catherine Lamb, who is an expert in neuronursing from Oxford University Hospitals NHS Trust, which is sort of about in the middle of the country in England. And we've got Matt Daly, who works closely with me on the Nightingale Challenge, a nurse by background, and actually worked in intensive care in England in the speciality of neurological nursing. So thank you all for being with us today, and really looking forward to the time that we're going to spend together with lots of exciting things that are going to happen. Next slide, please. So I just want to give you an update about the Nightingale Challenge and the Global Solutions Initiatives, to which this is our first one that we launched after we celebrated our first year of being the Nightingale Challenge. And it's really exciting that just when we look at the year that we've gone through, what we've been able to achieve, and many of you have been part of this, I'm absolutely sure, on this call. But just to say, we've got an impressive 29,115 nurses and midwives from 761 employers in 75 countries enrolled on the Nightingale Challenge. So, you know, we called young nurses and midwives over the world to join us, and they have clearly come in their thousands. And it's a fantastic resource and energy that we've created, for which we hope to work with SameYou and topics like this to really amplify the importance of nursing, but also the many specialties that there are within it and the difference that you can make to the lives of others. As many of you, I'm sure, will know on this call, that the work that we've been doing with Nursing Now and the Nightingale Challenge was all about creating that social movement at a real pivotal time for the profession, because 2020 has been the year of the nurse and the midwife globally, and we've been able to really utilise that despite COVID to keep the energy going around the importance of investment in nursing and people taking us a lot more seriously. So the Nightingale Challenge, just as a reminder, it's really called upon employers of nurses and midwives to step up and give them the opportunity to develop their leadership and opportunities for them to really show that they are the future, they are able to be developed as change agents, and have got some great ideas in which to make things better for the patients and local communities that they care in and within. And as you can see on this slide, if you want to know more about that, you can go to the website below. So the Nightingale Global Solutions Initiative, this is a pioneering project of the Nightingale Challenge. This, as I said, is the very first one, but this is really another opportunity to put the spotlight on how fantastic and creative early career nurses and midwives are, and what they want to do and be part of. And we're so fortunate that SameYou have agreed to work with us to really pilot this idea of giving young nurses and midwives the opportunity to put forward really exciting initiatives and solutions that will make things better for the patients and people that they care with that have had a neurological injury within their time. We are also really excited that you know, it's such a fantastic career to work in neuronursing. And there's some stats and facts that we've been doing across Twitter just over the last sort of 24 hours to say, it's a great thing to be doing, but actually how many people really treat it as a specialty? How many nurses and midwives understand that actually neurological nursing gives you a real opportunity to build meaningful relationships with your patients, to co-create care plans together and create real support infrastructures that mean that as a nurse you have a fantastic role in actually helping to change people's lives, helping to promote recovery, and really making things work for people that have been affected by neurological brain injury. So this solution is all about that, really. It's how can young nurses show us that they can find different and better ways to care for people that have had a neurological condition. And we're really looking to connect nurses to share their best practices and really give them the opportunity to be put on the spotlight to show just how they can really be agents for change and make a massive impact upon the people they care for. Okay, so a little bit more about the Nightingale Challenge Global Initiative. I can't get my words out there, and what we're trying to achieve. This is all about facilitating interaction and to drive the creation of partnerships. It's about supporting the development of what nurses can do practically to develop solutions that aren't just relevant to their country or their hospital or their organisation, but that also can be transferable and shared elsewhere. This is a place for you to come to share learning, to share ideas, to share best practices and lesson learnt. So there's nobody telling you what to do. It's a grassroots movement. So it's really important that, that it's seen as a place for young nurses and midwives to come to, not to be told what to do, but to come to and co-create ideas and better ways of doing things. And in addition to that, it will raise awareness of global health issues and an opportunity to develop bold ideas that improve more and better health actually for everybody that nurses care for. Okay, thank you. I think now we're handing over to Menashe with the next sort of set of slides to talk about where we go next.
Sure, thank you so much, Lisa. And it really is great to be able to be here and to have this platform this afternoon as we launch the first initiative of the Nightingale Challenge Global Solutions Initiative. And really, the Nightingale Challenge Global Solutions Initiative, as Lisa has just described, is an amazing platform. It is a platform for nurses and midwives, by nurses and midwives. And it really is a platform that is bringing nurses and midwives together to interact and look at how we can provide solutions to global health problems. Today, we have an amazing group of partners that have joined us. And it really provides a really great start to the initiative as we talk today about brain injury recovery. And as such, I would like to introduce our partners today. So our partners are SameYou. And I would like to introduce Jenny and Emilia Clark and Kat, who will be talking to us more about this first challenge in the Nightingale Challenge Global Solutions Initiative.
Great. Thank you so much. Well, hello, everybody. It's a great pleasure and delight for Emilia and myself and Kat to be asked to join you in this really important initiative. So being the first one, it's always a little bit frightening and what's going to happen. So I just wanted to give an introduction about SameYou. I wanted to explain why SameYou is interested and very committed to this challenge, why we're so committed to the progress of early career nurses and midwives, and ask my daughter Emilia to to really give you an insight into the charity. And then very importantly, Catherine, who is an important SAH nurse working in the John Radcliffe Hospital in Oxford. And she will really give you the detail, because she knows exactly what it's like and the challenges that she faces every day, looking after and helping people recover. So that's really what we're going to talk about, if that's okay with everyone. We're very, very keen to take questions and we'll do our best to answer. But maybe just a couple of minutes explaining about SameYou and our mission. So we launched our charity just over a year ago. So we're a very new startup charity. We launched in May 2019. And we're looking at various actions and various awareness activities to really start talking about brain injury, and in particular to get everybody to start talking about brain injury recovery. Because I don't know about you, but you are all in the profession, and so it's easy to see the importance of research and how investment and focus on research is really the life of medicine and health. And what that does is provide new answers to help people live, to survive, and to thrive. So we know that acute care is vital. And I don't know how many of you are involved, who are listening to this, involved in acute care, but obviously it's a critical point. However, we think that there's a third element that really doesn't get talked about. And extremely sadly, because of COVID, people are starting to talk about rehabilitation and recovery. But we see this as one of the first instances where it's been on the agendas of newspapers and media and governments around the world. Recovery is so vital, because when you are lucky enough to recover from your trauma, from your terrible illness, then you really need a lot of support, love, care, and attention to get your life back on track. So SameYou is here to really help promote the need for brain injury recovery rehab. And we really believe that increasing access to neuro rehab is the most vital thing that we as a small organization can do. So we have funded research with a hospital in Boston, Spalding Rehab Hospital. We are funding an important new training program for graduate nurses to look at the whole person. So somebody who is already trained as a nurse has an opportunity, or will have next year, to take part in a program where we have funded the way that people can look at nursing through a different lens. So it's really about, when you've had a brain injury, you do need the elements of brain, body, and mind. As laymen, that's the way we call it, to describe it. So we really think that it's cognitive, it's physical disability, and it's very much the emotional and practical support. So that training program's happening. And the last thing that we've done very recently is to try and respond to COVID, because clearly people who've had a stroke or a brain injury have had to leave hospital earlier than normal. And of course, people haven't been able to go into their homes to help them with rehab. And so with University College London, we have been pioneering something that's called Enroll, which is a virtual therapy, a group therapy, so that the great therapists at Queen Square in London are able to increase the reach and go using telemedicine to talk to people and to help people with therapy every day in their homes. So that's a little bit about SameYou. And so I'd like to now ask Amelia if she would really explain why she started SameYou.
Well, yes. So I'm speaking to you all as a founder of SameYou, but also as a patient, because that's where our story of charity began. It began with me having 2 brain hemorrhages. So when I knew I wanted to try and give back in some way, it was definitely after the first one. But after your life gets saved twice, then you sort of know that you're on this earth to help, because I'm still here and I'm fortunate to be here. And what Mum and I found out was that the lessons that we learned was exactly as saying, the recovery part of it, because you get a huge amount of attention when you're in hospital for brain injury, incredibly specialist attention, and you are rightly so being asked to be very careful with yourself, and your loved ones are under a huge amount of stress with being told to be very careful their loved one who has the brain injury. And it was when I left hospital the first time, and I'd spent my entire time there thinking, I just cannot wait to get outside, have a bath, be in my home, put your own pajamas on, all of these tiny small things that would have a huge impact on how I felt. And in the car leaving hospital, I just panicked, just get very panicked, because I'd been in such a safe space in hospital, and I'd had love, care and attention of such incredible nurses, largely, I've got to say, and obviously incredible doctors, but the nurses were there, you guys were there with me and holding my hand, and I felt like I had someone to talk to. And leaving hospital, you're in an alien environment all of a sudden, and you feel very unsafe. And it's specifically, I find, with brain injury, because regardless of what your repercussions are, there are a few commonalities that happen. Anxiety is massive. Fatigue is another really big thing. But on a kind of spiritual level, there's, when you've broken something that you can see, when you've broken a limb, when you have something that's showing the world what's wrong with you, people are aware, careful. But when you've got something going on in your brain and you look perfectly normal, you feel doubly anxious. You need to be double cautious with how you hold yourself and the position and the situations that you put yourself in. So I suddenly felt like being at home was the most dangerous place in the world. It absolutely wasn't. And so within few hours, I found a reason to go back to A&E. It wasn't because I thought that where my drip had been in for 3 weeks was infected. It was because I was too scared, because I just needed to go back just one more time, even though they'd told us everything that needs to happen. And I know that is an incredibly common thing, and that is where your recovery begins. I mean, your recovery begins when the operation leaves you intact as a human being, but really leaving hospital can be the single most frightening thing in the entire world. And then you have to create your own normal. And with a brain injury specifically, there is something so frightening about looking someone in the eye, because when your mind has failed you, when the thing that the place that you hold your personality, your soul, whatever it is, however you see it, wherever you believe your true core of yourself to be, a lot of people, it's there, it's in your brain. And so when that has failed you in some way, your ability to trust yourself and your surroundings is just, it's not there anymore. And so I was incredibly lucky. Not only do I have the best mum in the world and the best family in the world, but I also had a specialist nurse. So I could call her. I could call her when I had another headache. I could call her when I didn't know when I was meant to be able to wash my hair. I could call her when I felt dizzy or sick or whatever the repercussions were, or I was going somewhere or something happened. She was on the other end of the phone and she could talk me through and help me. And that was solely the soul part of the mind, body, soul thing. So Mum and I really were looking at this when we started the charity and started to see how we thought we could be of most help. Not only is recovery a complete white space, as Mum was saying before, the idea of recovery is something that's very new, because your health systems are under a huge amount of strain all the time, especially now, but all the time they are. And there's, rightly so, you as a human being worry when you go into hospital, you worry when you're there, you know what that is. You don't really spend too much time considering what it is when you leave and what the rest of your life might look like. But when you're there, that's the place that needs support at the moment. And that's the place that needs incredible people like you guys to be able to make patients like me feel safe. Because it's only when we feel safe that we can have the confidence to get better. And if you don't have the confidence, especially with brain injury, that just intrinsically is surrounded in such shame and such anxiety and such fear, both from yourself and also from, you know, every time I tell someone I've had a brain injury, they're like, yeah, it's that face quite a lot. Are you okay? Yeah. because it's a bit frightening. It's no one knows about it. No one talks about it, and that's a huge thing. And the reason why people don't talk about it is because there's a huge stigma around brain injury. We as a society judge it, and it's so sad, because the people who suffer from a brain injury are alone. They're alone in their recovery, and then they're alone walking around in society because they don't have the support of people going, I now understand, I'm aware of what brain injury is, and I'm here to help and guide you in some way. But you guys can, which is what's so exciting about this challenge, as someone who knows the good that you guys can do with just the smallest things as well. It begins, and I really believe this, because when I was in hospital, I had surgeons telling me a lot of stuff. I had doctors telling me a lot of stuff. A lot of it I didn't understand, especially because you're recovering. So you're like, I think I get what you're saying, but it's doctor jargon, and I need someone to translate it for me. And the nurses that were there when I said, why have I had this? Can someone tell me what they think it is? And I remember that there was a nurse who said, well, there's a lot of people that we see with this who maybe stress is something. And I spoke to my doctors about it, and they were like, no, you can't say that. That's not something we're allowed to say. So, but it was, stress played a huge, I believe, played a huge part. And that coloured my understanding of what my recovery should look like, and the ways in which I should take care of myself. And that was valuable. That made me feel better. And therefore that made me recover quicker. And I think that's the biggest thing that Mum and I are trying to do with SameYou, is to try and give people access to a more robust kind of recovery that looks at the whole thing, the whole human. Because when you're coming into a hospital for whatever reason, you are an entire human being that has a lot of individual needs. And with brain injury, those individual needs, the repercussions are so huge. There are so many things that can happen when you've had a brain injury, notably the physical repercussions, of course, where it's affected your cognitive skills or your speaking skills. But the silent things are the things that will slowly but surely eat away at you and diminish your quality of life enormously, and really have a massive impact on your confidence. And it's those people that I really care about, and that we're trying to help. And I know that nurses have made the biggest. I'm so proud to be an ambassador of nursing now, an ambassador of Royal College of Nursing as well. And I'm so proud of that, because at every turn, be it from my own journey with my own illnesses, or I lost my dad to cancer 4 years ago, which seems like it was yesterday. And the nurses that cared for him there were it was just the most profound kindness, the likes of which I have never seen since outside of a hospital. So I care very deeply about you guys, and I believe that you have within your hands the ability to truly change people's lives, like really change them, because it's changed mine, and I know it's changed Mum's as well. So we're incredibly excited about this challenge that we're setting, because I think that you guys could be the linchpin to really putting brain injury awareness on the map, and a linchpin of actually caring for people in the ways that they're gonna feel the best kind of recovery. So that's my little spiel. Mum?
Moment, yes, exactly. Wonderfully put. Thank you, Amelia. So it's quite hard not to be emotional after that, and I'm sure all of you have got similar stories in your own personal life as well as your professional life. But maybe it's the time to talk about the challenge itself and what we are asking or suggesting that you try and do. But the idea is that we see that there is a big gap. And the gap is that not enough is being done for patients and their families, their carers. Very important point. Once you've had a trauma, a acquired brain injury, between leaving hospital and getting back and trying to get back into society. Now, obviously, acquired brain injury is incredibly complex. Neither Amelia and I are professional medical people in any stretch of the imagination, but we've got the patient's voice. So that's one of the reasons we love you all so much, because, you know, as Amelia's already so beautifully said, you know, you are the key contact for us. And so when you have had a major crisis and a shock, you as nurses are there to help the patient and their family on their way back. So our challenge to you all is to try and look at the whole area of brain injury rehab. Now, I'm very aware that not many of you, perhaps on the call, or in fact going to be listening to any recording of this, are actually currently involved in brain injury rehab. Now, why do we know this, think this? Is because it's a very underserved area of medicine. So people don't spend too much money or enough money, or almost any money in some countries, about recovery care for brain injury patients. But we think that there's some very simple steps. We're not asking you to look at really complicated medical changes at the moment. We're seeing that nurses can absolutely look at the brain injury patient and describe the gaps that you see, and see how you as people and teams of people, and we think not just nurses, get other disciplines, other therapists, because recovery is very much about multidisciplinary recovery. So that's occupational therapists, speech and language, physical, all sorts of areas that you obviously know about. So get people together and try and identify the gaps and come up with a really good solution. Now, that is not such a daunting task, because a really good solution is all about the heart connection with the patient. Mm-hmm. So we've got a simple example. And after I've gone through it, I'm going to ask Kat to take over and explain how she sees this. But our simple solution opportunity is, when you see a family and a patient, and they've come into the ward and you're caring for them, what we would love you to do is to think about what simple ways you can take, to explain and understand and educate. Because our personal experience was that you've had such a shock, you don't always take in the first or the second or the third time when you're told. Exactly, Amelia. You know, it takes a lot of repetition before it sinks in what's actually happened. So we think that nurses could find a place in the ward or in the area, in the place where you work, and find a place where you can take the patient and their family, their carer, and get other people involved who are actually looking after them, and actually go through and simply explain what's happened, and very importantly, what they can expect to happen next. Because as Amelia was saying, it's the fear factor when you don't know, and you're rushed into hospital, you've recovered, you may be there 2 weeks, 3 weeks, much longer. And you get very protected in hospital, as Amelia said. So how can you as nurses find a place where you can explain more? So that's a very, very simple, but I think a powerful solution that doesn't automatically happen.
I'd also like to throw in, sorry Mum, I'd also like to throw into that, just when you guys might be doing that, I was thinking every time I got panicked on a ward, I would go to the chapel because it was always the quietest place to be. There was yes, it was a magical place to be. But when you're there, when you're talking to the patient and to the patient's carers, the patient's families or friends, whoever it is that they're to support them, if they're lucky enough to have that, the other thing in explaining what might happen is to then just ask them how they are, yes. Ask them how they're feeling, and just listen to what they might have to say. Because when you're on a ward as a patient, and I know this will be true for carers as well, for the carers of those patients, is when someone asks you if you're right, you're fine. What's the pain on a scale of 1 to 10? And you say that, but you're on a ward, you're seeing lots of people, you're very much on display. So I think being able to take your patient to a quieter place and asking them honestly how they're feeling, and then how their carers are also feeling, and just listening, that can have a huge impact, I think, because it's not something that gets asked very much, weirdly, in hospital, aside from the 1 to scale of pain and where it hurts and how it hurts and all of those very obvious things. But I think mentally how they're doing is a good thing to ask.
It's a very good build. So I'm going to ask Kat to give her opinion and her experience. And then after Kat, I'm going to go back and give you a few tips about how you might practically undertake this first challenge. And then after that, tell you what we're as SameYou going to do for the winner. So Kat, over to you.
Okay, hi. Well, thanks for inviting me back. Nice to see everyone, and hello to everyone who's listening. So this is a fantastic challenge. So I really hope that lots of people are going to take part. I've put posters everywhere on the wards, in the toilets, the place where people might sit down and take 5 minutes. It is exactly as Jenny and Amelia said. It's the simple things. So it could be like that, you know, the quiet space. Just, you know, maybe having you know, just information, whether it's a booklet, a piece of paper, you know, something that you can give to people so that they've got the opportunity to just get a bit more information, you know, point of contact, which is of course what myself is at the moment in my role, and what Tina was, I know, for Amelia when she was in hospital. So really my role is admission acutely all the way through to discharge, and it's being that connection to the family and to the patient, obviously. And you're right, Amelia, saying that when you know people come around and say, how are you, if the doctors ask you how you are, I'm fine, because I want to go home. Whereas you know the nurses will ask you, how are you, and you will open up a bit more, I think, because they might have a bit more time to just sort of sit with you and sort of connect, I think, as well. And you know, and it's important to link in with family members as well, because you know they're really anxious about people going home, understandably, but you know it's important to just keep that communication sort of channel open. And
Kat, that's
sorry,
great.
it's a bit in and out the
Kat, could you give some examples about neuronursing, because I'm not sure that everybody has got experience in this important field, and just maybe explain from a UK's perspective what different types of nurses are involved in neuronursing.
So for neuronursing, so we've got a huge selection of nurses on the ward, but it's an area that I think, as I said previously, it's kind of like a Marmite kind of job. You either love it or you hate it. It's not something that people will go into lightly. It's exciting. It's extremely rewarding area. People obviously think that it might not be because of outcomes that people might have, but to see somebody coming back into clinic who's recovered really well is fantastic. It can be challenging because of the nature of head injury or acquired brain injury itself, but anybody can come into this field of nursing, absolutely anybody, because you will get on the job training. There are courses that you can do which will help support that. You know, and it's just really, if you want to do this kind of role, then it's about being caring and compassionate, communicating, treating patients holistically, you know, really essential.
Catherine, do you think you could, Kat, sorry, just called you Catherine.
Sorry, I know.
I was like, do you think you could tell everyone again what exactly your role is and
my
what
role?
It entails?
Yeah.
Really
so I qualified in 2000 and then sort of been in neuro for a long time since then, so sort of 20 years, but my role is a specialist nurse for subarachnoid hemorrhage, which is a particular type of bleed around the brain, and I will see people in the acute phase when they're first at hospital, and I will meet them and their families, and then I will link in with them throughout the whole admission onto discharge, obviously discussing with the MDT about sort of rehab needs. I try and work with the physios as well, if I can, so that I can go to the physio to the gym with the patient, so that when I am talking to families or referring on for rehab, I've actually, you know, seen how they're doing, and I can actually tell them that I know how they're doing. I'll run MDTs. I'm involved in giving sort of information to nurses on the ward, sort of troubleshooting if there are any problems. You know, the deteriorating patient, you know, linking in with the medical teams here as well with regards to that. It's about educating sort of everybody, looking at guidelines, audit, research. I mean, the list kind of can go sort of on and on, but essentially being there for the patient and the family. And then when they've left hospital, I'll be involved in all their follow-up on behalf of our consultants here. So I do lots of telemed clinics, do face-to-face clinics, not at the moment, obviously lots of telemed at the moment. And then all of the patients I meet will get invited to the head-to-head focus group, which is something I run for patients and families when they've been discharged. So they've always got the opportunity, if they're having a bad day, to link in with each other. I think it really resonates better if you're talking to other patients who have been through it or other family members, because I can say, oh, that's normal. It's okay to feel like that. But I think it probably resonates better if it's patient to patient and it's confidential and it's online and it's 24/7. So we do try and meet as well every 4 months, but obviously at the moment I'm changing how we're doing it. So we're having quizzes online and things like that. So it's very different, but it's about being that one point of contact, I think, that the patient and the family member can always ring. And if you're struggling with symptoms, hopefully it will help prevent GP presentations, help prevent readmissions as well, if there's any simple solutions I can offer over the phone. And it can be something like they're very fatigued and they've done a bit too much and that's why they've got a headache. So it's about talking about pacing. Yes, you're not the first person. A lot of conversations I have is about, you must pace your activities because I think this is why your symptoms have happened. And
can I ask you a question? This is just as much because I'm just wondering as anything else. Would you say there are a few common things that you're seeing mainly in your patients, aside from the physical repercussions with regards to where that brain injury was and the severity of it, sure, but are there things that you see time and time again that maybe our nurses might know to look out for, and to kind of the ways that you think that what kind of support you get to offer them that really helps?
Very much with things like sensitivity to noise and smells, and fatigue. Fatigue is the biggest problem that I notice from people when they're in hospital as well, but especially when they've gone home. Sort of when they want to return back to work, it can be quite difficult, and GPs might not understand that they need that extra time off, and the employers might not understand that they need the extra time off as well. But in hospital, just having some quiet time, if they can maybe give them an eye mask, some earplugs, turn the lights down a bit. It's not possible to always have a private room or anything, but certainly with some of our patients, if they're really struggling with sleeping or finding noise extremely irritating, then we will try and put them into a side room just to help sort of facilitate that.
I remember the smell one so much.
Yeah.
Really, really, like this. Yeah, perfume was just too much.
Everything's just
one. Yeah, the fatigue one, that's something that I definitely still am living with. It's a funny, I used to call it, it's just, someone would say, what the vegan, and I'd say, fatigue, but it's just a fancy word for tired. Like, that's all it is. And
it's huge though, isn't it? It's huge.
Yeah.
It's debilitating, and it can really set people back.
But the thing that I was going to say to talk about fatigue is that it can feel very shameful. It can feel like you've done something wrong. Like you're always trying to understand why am I so tired, what, and especially as someone, as nurses, if you're going to be caring, or you see, or you're in someone on your ward who's young, who's got a brain injury, fatigue, I can't begin to tell you enough how much of an effect that has on your confidence. Because you should be out and you should be with your friends and you should be living, you should be doing all these things. And when you have fatigue, it just cripples you and you feel like half a person, and you feel like you've done, like it's all your fault, and there's something, do you know what I mean? And I think that can, left unsaid and left untreated from a mental point of view, can really have such terrible effects, because you just then don't do anything because you're like, well, I'm actually too scared to get too tired and feel like I have to make an excuse.
Yeah, and people feel really guilty as well that they're fatigued, and they feel guilty that they're not going back to work, and I feel so bad, my friends want me to go out for dinner, and I'm like, it's fine, and what I do suggest to patients is to write a diary of their fatigue and what they've done, what they've been doing, what kind of seems to trigger it, what things make it worse, and then they can then see if there is a pattern. Was it because Aunt Marge came and saw me and she was talking too much, or was it because of, you know, other things?
No, absolutely. Yeah, that's
and
really good. Yeah.
As a carer on that fatigue point, I think it's really important for nurses to be able to explain to families and friends that contrary to what my daughter's just said, fatigue isn't just tiredness.
No, I know that. I know.
She said
it was my excuse. It was my. I would tell people because I was too ashamed to be like, it's actually a real thing.
Yeah, exactly. But I think it's really important that the family knows, because I've talked to patients, and one person in particular I spoke to about 5 years ago, and she'll never leave me because she was so heartbroken that she used to be a policewoman, she couldn't work anymore, she had a young family, and her mother's just said, look, you know, you need to be out cooking and you need to be doing this and you need to be looking after your children. And she was just too tired, and her mother couldn't understand that. So I think as a mother, I really felt that was such an important lesson for carers.
No, absolutely.
We're really talking about carers as well as
completely.
Yeah.
And I think the thing that I think and Kat, like you're saying with the groups that you started, and other ideas maybe that I know that I would have loved, and I know that SameYou's trying to create ourselves just now, is patient groups and carer groups. So on Enroll, the online clinic that my mum was talking about before, that we managed to put together during COVID, which has been such incredible effects after that, which is really exciting. But there's something called the Carers Cafe. So carers of those patients can talk to each other and again swap stories and feel like they're not alone. But I think having patient groups that's led by one of you guys, that's led by a nurse, so that you can oversee it to make sure positive and
that's what I'm like. Just want to make sure everyone's talking positively. There's no hate speech and stuff. And they're brilliant. They're a brilliant group.
But I know that if I'm talking to anyone who's had a brain injury, it helps. It just helps. It helps to know you're not alone. And that's again the single thing that nurses do.
Yeah, and we've got community links as well, so because we can't have our meetings all of the time, we've got people in different areas because we take from such a huge area at Oxford. So we'll give out the card of an ex-patient who's willing to be just someone that they could go and have a coffee with or something. So we're just trying to build that up a bit more, but it's a work in progress still.
That's a beautiful idea for the challenge, isn't it?
Oops, give it away. They can still have that one, it's all right.
Exactly. No, that's good. So should I just talk a little bit about the challenge, and we sort of put together some notes that may or may not be helpful, but you know they're here, and then we can see where we are after that. Is that all right with everybody?
Yeah.
So I think one of the first things as you're thinking about taking part in this challenge is finding yourself a mentor or a coach in your place of, because it's a big thing to try and do this as a young career nurse, and so I think you need some support and help. I also think that's a jolly good thing for your career, because you know old people like me just like to be asked to give advice, because that's how it is. So I think that the other important thing is that you need to find, if you've got permission, to seek out and talk to patients who've already been discharged, because when people are in recovery, they will give you the best ideas. So as well as your medical training and your experience, I think try and meet people and ask them what their experience is like in rehab, in recovery, in aftercare, and what they see as missing. So that could be a really good way of you finding the gap in your particular area. It's also important to talk to those guys called neurosurgeons and interventional radiologists, because they're pretty good. But they also have a very different point of view. So they're so thrilled that you're all there, the patient's there, and then they go. And I also think that it's a very, very important point that different medical disciplines have different approaches to recovery and rehab. And I think that for nurses to really amplify the idea of hope and the idea that if with care and a lot of repetition of treatment and therapies, you are going to absolutely keep on getting better. Now, obviously, I'm not medical. Obviously, it doesn't happen with everybody, but a great amount of people can improve their quality of life by the dedication they personally put into it. And I think that one of the things as a sort of an idea is for you to think about how you would help empower patients to get back and take control of their recovery. Because I know, because of Amelia and myself and my husband, that when you're in hospital, you feel very cocooned and protected, but you need to take back that control when you get out of hospital. So I think talking to all of the brilliant people involved in neurocare is really essential. And very importantly, don't just think this is just a challenge just for nurses, because it's all about the multidisciplinary teams. So the speech and language, the physiotherapists, the occupational therapists, all these people involved will really help you come up with some great ideas. Now, very practically, you need a project plan. So a project plan.
This is Mum's strong point, ladies and gentlemen.
So it's a project plan. You need a timeline. You need to work out the milestones that you've been given through Nursing Now and the Nightingale Challenge, and you need to work out what you need to do to meet those submission timelines. And you need to map them, and you need to really internalize those and say, okay, if I'm really going to take part in this, I'm taking part because I'm going to win, and really get your competitive energy up and your excitement about this really going. And I think that an important part for you in thinking of a practical solution is to think about the financial implications for your place of work, about your idea. Because sadly, there isn't a financial element to this challenge that we or Nursing Now are able to give, but you can certainly understand the implications for finance. And I think that's really important because it means that you're being very pragmatic in the solution. And I think that the really important thing is stretch yourself with this and really, really figure out what's going to help patients and their families. And whether you win or not, maybe see if you can get it implemented. So that was.
And Lisa has just added to everyone as well that this, and she's completely right, this is a wonderful opportunity to get creative.
Absolutely, yeah.
Yeah, because that, I know when I was in hospital, I kept trying to paint. Can't paint, but it was a fun experience to learn that I can't paint. But other creative things that you can encourage with your patients, I think, is a lovely distraction, if anything else.
Because the creative arts in helping people recover, you cannot be underestimated.
Stories. I kept wanting to be read to because I couldn't read because it was too painful. And I couldn't look at a screen because, again, too painful. So I kept getting my family to read to me to varying degrees of success. So if I'd had a nurse who could give me a few sentences, that would have been really, really good.
Yeah, and I remember we gave you a story, and then you had a major relapse the day after. So I don't know.
Yeah, I remember that as well. Yeah, yeah.
What did she say? Yeah, which you choose. So that's good. So so that seems to be some ideas, and it's great. In fact, if anybody on the call could come up with their own ideas to help people thinking through what their challenge could be. But maybe it's just take a minute to just say what SameYou will do to help you with this. So at the winner will receive a SameYou Nursing Now trophy. Not quite sure what it is yet, but there will be one. It's
going to be brilliant.
You'll really want it, and you
really want one.
You can show all your friends and family. And so along the way, helping you do this, actually implement the challenge. So after you win, SameYou will mentor you to help you think through how you're actually going to make sure that your idea is sustainable. So I'm afraid it's only going to be me probably at the other end of a Zoom call, or maybe you could as well, maybe me, or maybe we'll let you do that. And then there will be checkpoints that we think that we can take part in to help you again implement your solution. We will, if you'd like and find it helpful, talk to your hospital management, if that's appropriate, or your management of wherever you're actually working, and then explain to them about the challenge and explain the support that you will actually need as a winner. We then will feature you on our website and through our social posts that wonderful Claire and Tanya and Angela actually put out for us. So we'll interview you, we'll find out about you, why you are a nurse, what your career goal is, why you want to be a leader in nursing, and why you're taking part, and then what your real passions are. So those are some things that SameYou will be delighted and thrilled and honoured to do to help you on your way to win the challenge.
So exciting, isn't it?
Yeah.
Great. I want to enter.
Right.
You can.
Can
Yeah.
So I don't know, maybe Lisa or Maneshe, would you like to say something before we ask Matt to explain the real detail?
Thank you so much. I mean, I've just so enjoyed listening to you all. This is just the best opportunity. I think one of the best opportunities there are out there at the moment. Not only to really learn about how you can work with a charity like SameYou, but how you can spread the message across the world. It's just so powerful, and I can imagine loads of early career nurses and midwives out there that are thinking, I want to do this. Where's the entrepreneurial flair in people? This will get those juices flowing. Those that love to be creative and think differently and really be ambitious about the difference that this can make, because this is a global platform. SameYou is an incredibly powerful charity. You've got a fantastic superstar that, you know, is really up for championing it in so many ways, and it comes from authenticity because of the fact that listening to Amelia's real story is just unbelievably beyond powerful. And so this is genuine, it's really authentic, and it's kind of a bit of a once in a lifetime opportunity. So just go for it. We've got a guidance book out there, we've got contacts if you want to check anything out, but you know, be fearless and really take up this challenge, and let's all work together to see what we can achieve. I think it's going to be brilliant. Thank you so much.
Thank you, Lisa. Before I stop talking, could I ask something of all of you? That would be brilliant if I could, because our big passion and mission is to spread the word and get people talking about the needs of brain injury patients when they have left hospital. So we would love all nurses who are going to be listening to this to talk to their colleagues, to talk to their families, to talk to their friends, to really show that brain injury recovery is a real gap in the health market. So please join us. We have a small team of people, but we'd love to hear from you. We've got some wonderful people. Alex, I can see already, one of our amazing SameYou champions, raises money for us, raises awareness, does all sorts of things for us. And we've got Sandy from Spalding Rehab Hospital in Boston, an amazing place where we funded some research on resilience after brain injury. But we really need the whole world to start talking about this and to really make a difference. You will all make such a difference if you could help us tell the story. Thank you.
Yeah, thank you so much, Jenny and Amelia and Kat, for sharing that. And I really think that this really is a great platform for us as nurses and midwives to be able to come up with innovation. And it really is exciting being able to think around how we can be able to provide solutions to some of these challenges and brain injury recovery. And actually, like as Kat was talking right now, like I started getting quite a lot of ideas that just started coming. And yeah, it's really amazing and really exciting to have this as the first challenge. So yeah, looking forward to it.
That's so wonderful. Thank you so
great.
much.
Yes,
Thank you for having us, everyone. And I
Yeah.
hope it's been, I hope it's been useful. And we cannot wait to hear everyone's stories as to this challenge. And exactly as my mum said, let's do, please. If the only thing that happens from after this is that you start talking about brain injury, then that's huge. That's massive for us. So thank you so much. Thank you, Lisa. Thank you, Nursing Now. Thank you, Kat.
But we've got
Thank
Matt.
you, everyone.
Now, Millie.
Yes.
Thank you. No worries. Okay, so let's get you started on the challenge, and I'll give you all the information of how you can present and give us all the information and make your start. Okay, so the start date is today. The submission of concept note needs to be with us at Nightingale at nursingnow.global by the 23rd of September 2021 by midnight. Okay, and that's British summertime. Now let's give you some information. Don't forget that we also have the Nightingale Challenge Global Solutions Initiative Facebook page as well, and all the details are in the chat box, so you can access them there. If you just go into Facebook and look up Nightingale Challenge Global Solutions Initiative, you'll get into there, and there'll be details of all today, and also the submission details that we're going to go through, and all the guidance as well. And don't forget to use your teams. Multidisciplinary teams is what we use. Bring them into it as well. You've got physios, you've got speech and language, the occupational therapists, dietitians, nutritionists, everyone. Get everyone involved, because you're going to get a better view. So then, to get started, each challenge commences with this webinar, and that will give you a good start of all the information that you need. So the challenge is issued. Don't worry if you miss anything. A recording of this webinar will be available on the Nursing Now website as well. Okay, so if you're scribbling away furiously, there is a recording of this. And then don't forget, like I said, to join the group and join us. And once you're confirmed, you'll be interact with also all the other nurses, midwives all around the world as well. It's really important to have this global approach to this. And you can also access the full guidance on the website. Okay, so the first step of your concept note is to tell us about you. So share with us your name, job title, employer name, and if you're interning as a group, okay, the details of each member of that group, and also your contact details, so we can actually get hold of you as well, so we can actually get the information from you. And your big idea, okay? So you need to summarize your solution in 150 words or less, otherwise it will be an absolute novel. And this is your elevator pitch as well, okay? So you need to summarize what the challenge is, why is it important, and your solution that will address the challenge. And that's, again, a limit, 150 words. And the context, okay? Tell us about the challenge or issue that you're speaking to address, and is that local, national, or global? Okay, so what is the whole picture? And then you can describe your solution. You're going to tell us, what are you going to do? Okay, detailed description of the solution that gives your idea for the solution. How will you work with others? How are you going to implement it? And how will you, most importantly, evaluate it as well? So a lot of thinking going on. And also, does it actually address the challenge that has been identified? How will you improve the outcomes, benefit the targets, okay? And what makes your approach innovative, okay? So what makes you so change-worthy? What is that innovation? And working with others. Who is needed in order to make this solution a reality? We spoke about multidisciplinary teams. Is it just nurses? But there's a bigger world out there. There's a lot of people that can be involved with this, okay? And also, what other stakeholders? Have you already identified them and engaged them in the design of your solution? When you come to implement it, what resources will be needed? And how do you mobilize the resources? Do you need approvals to make this happen? And how will you do that? And what is and one of the main important things is it sustainable and is it scalable? Is it just local or could it be shared all around the world? How will you evaluate the success? How will you spread the word and get a wider uptake? And how, importantly, will it support the leadership development of the early career nurses? Okay. Does your solution encourage the improvement of the early career nurses for influencing policies and decision making as well? Okay. And in conclusion, to boil all this all down, to make it nice and straightforward, conclusion of 150 words. Tell us about yourselves and what made you submit your solution and how participating in this initiative is supporting your career and how we use the contacts made and the knowledge gained. Again, we spoke about mentors, very, very important for you. Okay, you can access coaching and mentorship. Finally, engage with us, okay? Use the Facebook group, it's there. There's lots of people all around the world that want to share, they want to talk, they want to engage. Start the discussion and debate about the topics raised in the group, okay? Not just in the group, but also take it back with you and share the resources with each other and really importantly, inspire each other. Be creative and be very, very, very ambitious. Again, so the start is today. Submission of the concept note needs to be with us by the 23rd of September, by midnight, British Summer Time, and the email address is nightingale@nursingnow.global. And I think we're going on to your questions, question and answers.
Yeah, thanks, Matt. And I hope everybody's got that information, but don't worry because it will be available for you on the website. But hopefully it's quite specific and will help to guide the exciting ideas that you have. So we've got some questions in the chat box. And Jenny, the first question is for you. So the question is, do you have similar experience with leaving hospital, the anxiety that Amelia spoke of? I've heard many of families express anxiety after everyone has been discharged.
So that's a very good question. And so because Amelia was in hospital, both in London and New York, I've had 2 goes at that. Yeah. So the anxiety is very much, you know, yes, how is she? How is the patient? How is your loved one? Is it safe for them to leave hospital? And then as the responsible person, or one of the responsible people in a family or in a community, what is my responsibility? So what do I need to look out for? Are there factors in brain injury recovery that the carer needs to really understand? Because it's danger for the patient if the carer doesn't understand that. So that's a really important set of facts that the carer should really be aware of. And then I've also had, I've got 2 aneurysms myself, so I've been in, not anywhere close to Amelia's situation because I haven't had brain hemorrhages, but you know, I do know that the fear factor as a patient as well. And I think that from a patient's point of view, it's important for the carer to really be as positive, genuinely as positive as possible, because you know fear is very infectious.
Yeah,
and you don't get.
Thanks, Jenny. That sounds incredibly comprehensive. Amelia, did you want to come in?
Well, I mean, yes, I then was a carer for a hot second with Mum,
Right.
and yeah. I couldn't lie, you see, because she knew. She knew exactly what was going on. So yeah, my brother and I just did ultimate distractions. But Mum had an amazing operation that was a preventative procedure that went right. And
right. Well, that kind of leads a bit to the next question, which is it possible to completely eliminate the effects of brain damage? And it might be that Kat wants to maybe come in as well on this to talk about this. I'm not sure, Kat, is it? Are you there?
It's really dependent on each person and sort of where the injuries happened, how big, you know, the bleed and things are. But it's certainly, you know, a lot of people are able to get back a lot of function and, you know, return to whatever normal is, but return to a life which may allow them to go back to work, to do things, to go out with friends, to do that kind of thing. But without that rehab, then it really doesn't happen. If people need that rehab and if the gaps are there, which they clearly are in some areas, very, you know, postcode lottery, then you know, without it, then yeah, they may well not do as well as they possibly could. So
thanks for that, Kat. And actually there's a linked question from one of our fantastic Nursing Now board members, Adela from Spain, who just put in a message about with COVID, there's many families that can't get in to see their loved ones, and maybe there's a solution in there, guys, to think about. But any thoughts about how else you do this, so that people don't feel lonely and isolated in COVID, or if if there's other sort of infection controls that are in the organisation that prevents lots of contact with loved ones?
Yeah, it's really, really difficult, and we've noticed it obviously a lot with patients because people can't come and visit. So we're kind of using iPads to try and get people to do FaceTime and things like that with their relatives. We started having visiting now, but it's only for an hour, sort of once a day for that person. So it's getting there, but it is really difficult because families really do help with that recovery, and I think it really boosts people's morale, and it makes them think of, oh, I'm going to get better. I'm going to go home. I'm going to do this, if they can be in contact with people. And we rely hugely on families when they're there, even if it's for things like feeding, just being with that person and helping them with their food and drinks and things like that, and the company.
No, exactly. And that's a huge amount of stress then on that family, because they know how vital that is. With regards to COVID and not being able to see each other, I know I was in another country when my dad was in his last days, and we FaceTimed, and if it weren't for that, I don't know what I would have done. So I do think that has a genuine impact. I really, really do. As speaking from someone who, as someone who's experienced a version of that. But but then as a patient, just getting incredibly panicked when my family weren't around.
Yeah. And Amelia, another one that's similar again, but sort of linked to this contact and ways of doing it differently. We've got an idea about using chat box for patients and patients to talk to each other about what's going on. I mean, I know you're kind of an advocate in that space, and I've got a program of work with SameYou. I'm incredibly bought into patients co-producing and patient experience co-producing care pathways with clinicians. What do you think? How far can you go on the technology front with this, do you think?
Well, I mean, any way that a patient can connect with another patient is vital. It's impactful. It's important. Sharing stories, that's what you were asking, Lisa? Is that?
Yes. Well, I think maybe the sharing of the story, is that one of the most helpful things that can happen between two patients when they're going through this.
Yes, hugely. And I think it does. Not only does it calm you, because you hear someone telling you your own truth back at you when you feel like you are the only one. You feel like you are completely alone, and you're not. So hearing that someone else is sharing that is really, really huge. Then also it's very empowering for the person who's doing the sharing. Let's say that you've got one patient who's very new in their recovery, talking to someone who's a little bit further on in their recovery. You're empowering that person further on in their recovery by getting them to advise someone who's in a worse place than them.
Yeah.
And then that person who's in the worst place is going, oh, well, look at this, is brilliant. I've got somewhere I'm going to go. I've got someone I can talk to. That kind of mentoring program is just massive, because it's just so unknown. You are so scared. You are so alone, and no one knows, and no one has an answer for you. But then you look at someone who's has been through the same things as you, and it does wonders. It just does wonders. I think it's a bit of a weird reference, but the Alcoholics Anonymous group idea, the premise of that is up to people. And I think the germ of that idea is relevant when we're talking about this.
Great.
And very, very quickly, Lisa, so what we did at the start of COVID is we worked with Spalding Rehab Hospital in Boston and UCL in London, and the two programs were about group therapy. And the clinicians, particularly in London, had told us that one of the big advantages of the group therapy, that, by the way, London hadn't done before, was that everybody became a community of themselves. And so, just as Amelia said, there are lots of evidence with the people that we've already gone through the program or going through the program, feel that they have got a new community and they can help each other. So that's really important.
Because the first time I was in hospital, I was on a ward, and I loved being on a ward.
Gosh.
Because I got to see people. I got to see people with brain injuries, and I got to kind of feel like we're all in it together.
Yeah, I bet you resonate with that, Kat.
Yeah.
when you're in
Yeah.
the room, it's a bit.
It's lovely when you have patients in the same bay and they'll be like, well, she's got the same as I've got, you know, so they've been chatting to each other, and I'm like, I can't really comment, you know, confidentiality, but I'm like, just get off, fine, if they want to talk together, if that's helping.
Oh, that's brilliant.
And you can also see what everybody else's families eat as well at the bedside. That's fascinating. Grapes, whatever.
Yeah. Brilliant, brilliant. And I guess the nurse's role is quite pivotal in that, because of, you know, when you walk into a clinical environment, you get a feeling. They talk about 12 steps, don't they? I mean, Kat, you'll know about this, I'd imagine. I bet you've done quality improvement work. I certainly have, where you look at the environment you create, and they reckon within 12 steps of walking into a ward or a clinical environment, you get a feeling of either confidence or doubt. And I guess, Kat, you know, maybe one of the solutions is how do early career nurses foster that collaborative, safe environment, not only for the loved ones to know their people are being looked after well, but actually they've got the confidence to get them talking to each other, and they're not too rule bound. Like you say, I think you're a brilliant example of confidentiality is an issue for us as professionals, but it's not if actually patients want to talk to each other.
No, that's fine. Yeah, if they want to talk together, then that's absolutely fine. And then you can get involved as a group, because you're like, well, I've kind of got permission now. So they've talked about it with each other, so I can join in. But I think nurses, I think greeting people with a smile, introducing yourself, you know, my name is a very big thing, which they, you know, across all trusts. So just, you know, letting people know who you are, that, you know, you are busy and you're doing things. So that's why I'm not with, you know, your loved one right at the moment, but I'm only here if you've got questions and things like that. So I think it's just putting people at ease and knowing that, you know, maybe giving them a few tips of how their day has been, what they've been doing, so then they're kind of a bit prepared when they go and see the patient as well.
Yeah. Brilliant, thanks, Kat. A couple of other questions are coming in, a bit more about the story, Jenny and Amelia. You know, there's a couple of questions, Amelia, about what keeps you motivated, and really, Jenny and Amelia, when did you decide to start SameYou, the charity? Was it when you were in the thick of experiencing your brain injuries, or did it come some time after?
Yeah, well, I mean, I was, when you know that you're unbelievably lucky to be alive, it sort of happens to you. You sort of think, right, well, I must use this life then, and I must try and help people. At least that was my very first thought. And it started as a couch for the visitors room, because my mum and my dad and my brother were there the whole time. And the visitors room they'd come out of a bit like this, kind of, no, we're really comfy, it's very comfy in there, and they'd sort of have all these cricks in their necks. And at some point I was like, I think we should buy the ward a lovely sofa to pop in that room. And that's how it started, and now we're here. So it just kept getting bigger as I realized what the scale of the problem was, and as I realized what kind of a reach I could have, it felt only right. And the more we looked into it, the more I saw that this was something that could have a really big impact. Because, I mean, I was really not going to tell my story, because I was just petrified that the world would think it was a celebrity sob story and they wouldn't care, or they would, I don't know, just think it was crap. And I was so determined to want to start the charity, but I knew I couldn't start it without saying my story, because people would be like, it's a very particular thing that you're getting into, like, why is that? And so I'd said my story and held my breath, and here we are. But so far as motivation, it's been the same thing since the beginning, which is, it happened to me and I was unbelievably lucky, not once but twice. And I really can't tell you how big the bleeds were and how incredible it is that I am here with all of my functions and everything fine. It is remarkable. And I have my incredibly loving support system, and I had a job to go back to, who were like, would like you. And yeah, the fatigue thing, I ignored that completely. I just went straight back to work, and it was not, but I just kept imagining myself as a single working mum with 3 kids, with less of the fortunate nature of my particular injury, and I just kept putting myself in that person's position, and I don't know how that person does it, and I don't know how that person would do it. And it was that really that made me think, well, then we need to be able to give people the kind of support that I have, because I'm lucky that I just have. It's just there. I'm pathologically optimistic. It's in me since birth. That didn't go with the brain injury. That didn't get interrupted. But I just get, and the more research that we've done, the more I see the stigma around it, the more I see the shame around it, and the more I see the heartache and the pain and the total aloneness, and the fact that to some people having a brain injury is a fate worse than death, and they still have to wake up every morning. They've got to go to work. So what can we do? How can we help? How can we help these people live the life that they were given? Because their lives have been saved and they are here, and we've got to help them. So the motivation is easy to find, basically. Very easy.
Well, that's fantastic, Amelia. I don't think there'll be a dry eye on the webinar. That's just amazing. Thank you for that. There's a couple of other questions that are probably a little bit more on the sort of practical side, and I just want to refer back to Jenny and Amelia's point and Kat's about the power of the team that works around people that have had a brain injury. And so this is definitely an early career nurse led initiative, but it doesn't mean you can't do it with a team, or you can't work with students or other members of the multi-professional team to come up with your challenge. I just want to double check, Jenny and Amelia, that sits comfortably with you, doesn't it? It doesn't have to be just the one person. You can come together with your colleagues to come up with the solution.
Yeah, definitely. 4 heads are better than one every time.
Yeah, and that can be students as well. You know, if you've got students that work with you, I love students. I think they come up with some of the most amazing ideas because of they're fresh to everything. So it's definitely, it can be a team submission, can't it?
Definitely. And I think that even thinking really outside the box and getting people involved who aren't necessarily on the care staff. Talking to people who are in administration or emergency ambulance drivers or whatever it might be. There's lots and lots of value of that. And I think we all need to learn that, you know, the world is a really big, terrifying place. And what we're talking about is a really terrifying thing for patients and their families. And you need help. Everybody needs help. So our advice is always to collaborate, because, you know, it's only by sharing can you find the right answer.
Yeah. Brilliant. Well, I think we've probably covered most of the themes of the questions now. So I don't know, is there anything anybody wants to say to wrap up with this? I mean, Meenakshi, as a young nurse and leading our young nurse community, how are you feeling? It's just so exciting, I think. But from your point of view, because, you know, we're all about young nurses here and early career nurses being the pioneers and breaking that new ground and making the difference that we clearly can see is needed here.
Yeah, thank you so much, Lisa. And I really enjoyed, I think, mostly just listening and really learning a lot, because that's something that's is able to then help in being able to look at what are some of the solutions that we can be able to provide to some of these challenges. Being able to listen, being able to hear these stories, I think it's really impactful. And personally as well, I think just going through this session, it's also sparked an interest in neuronursing as well. And yeah, so
Yes.
So that's really amazing. And I know a lot of young nurses that are on this call as well. They've they've developed that interest as well. And yeah, so it's really amazing to be able to have this webinar and being able to have such amazing champions such as Amelia leading on this.
Thanks, Meenakshi. And anything, Kat, while we're hot on attracting people into neuronursing, any top tips from you if you're a young nurse that wants to get into this?
with my catchphrase, just do it. Yeah, just it's an amazing area to go into, and it's fascinating. As I said before, it's challenging, but it's well worth it. And I definitely wanted to add about student nurses should get involved during this challenge, because they are the fresh eyes. They're new into it, and they're absolutely brilliant. So yeah, fingers crossed to everybody who's going to enter, and good luck.
Oh, brilliant. Thanks, Kat. And then Amelia and Jenny, anything for you to say, what would like to wrap up?
Well, I'd just like to say thank you to nurses all over the world, because particularly this year with the crisis of COVID, my goodness, haven't you all worked hard, been incredibly self-sacrificing and amazing, and the world couldn't exist without you. So Amelia and I are all for more recognition on every front for nurses, early career and more senior nurses. It's about, you are absolutely the heart of healthcare. So keep going.
Yeah, thank you so much, everyone. Thank you for just existing.
Well, I think on that emotional note, it's been brilliant. Thank you so much, and I think we're really excited. Well, I know we're really excited about this solution. The bar's been set high, so let's go for it and change the world with the things that we've talked about. It's possible to do. I think that's the feedback I feel from you, Amelia and Jenny, that actually we can change things. They don't always have to be huge things. They can be quite small things, but they can change and make a difference to how people feel and how they go on that recovery journey. So let's not underestimate anything that's possible.
And it's good, because the more we talk about it, the more that maybe governments might recognise that there's a need, and then put money in, so that it isn't relying on charities to fill that gap that should be filled already. So yeah. Fingers crossed for that as well.
Absolutely. Great. Thank you so much, everybody, and really excited for the next steps. Take care. Bye-bye.
Bye.
Bye.